What do you say to totally overwhelmed parents?
Yeah, I think that's a really good question. There's a whole range of families, right, that we all might be having contact with in different ways. And I think a helpful rubric is thinking about a hierarchy of needs. You know, when you take intro psych, that's one of the first concepts, like Maslow's hierarchy of needs, right? And to remember that we can't be thinking about these more subtle emotional issues when there's insecure housing, when there's food insecurity. Um, we need, and also, I think if you're talking to an individual in that situation, it could be very inadvertently invalidating to go to some of these more subtle issues. And so the validation alone, if we can help in connecting to resources, remember that hierarchy of needs is really the bedrock, right? I know for myself that I couldn't parent, well, in a situation where those kinds of basic human needs were uncertain, right? And so that's the bedrock. And for a lot of families, they will stabilize if they have that bedrock, right? There's a lot of resilience in human beings. And for us to keep that in mind and, to remember that for some parents, there may be some pride actually when interacting with a clinician in terms of even admitting that there are those kinds of economic vulnerabilities. And of course, to keep in mind that it's not as easy for family or friends, close friends, to take people in because of the need for social distancing and, having elderly or other at-risk individuals in households that need to be protected. So we need to keep those things in mind.